Okay.
Thank you.
Thank you, Lesego, for the introduction, and thank you for the opportunity to give a lecture again and on something that's very common, and I really appreciate it that I can do this tonight. And thank you to all the attendees, and I hope you're going to get some valuable information from what I'm going to present, because standard operating procedure, or SOP, we're going to talk about SOP. It's not a manual that's common practice in nursing care and healthcare. So we all know SOP, what's a SOP, but the focus that I'm going to give tonight, that I'm going to focus on, is, do we really know why we need the SOP, what must be in the SOP, and what is the quality of our SOPs? So let's go and look at the introduction. The meaning and the reasons of standard operating procedures is very often misinterpreted by healthcare workers. They see the SOP as as a policy and not as a SOP that's coming from a policy. Now, some of you is being at the presentation last year where I spoke about policies. You will know what's the relationship between standard operating procedures, SOPs, and policies. But just to repeat for the people who hasn't been there, you operate your policies is very important. And if you look at the policy, it's been created to resolve problems that has been experienced. And to solve that problem, you need a SOP to tell you what to do step by step, where the policy is only guiding you. So according to the South African Nursing Council, the scope of practice of nurses, the standards for nurses, and the competency are something that's used interchangeable. And that is, they're working together, but it's not the same. And people sometimes not sure. We're talking about policies, scope of practice. We just talk about standards. What are standards? There's a lot of standards, and the competencies of people that they need. So to differentiate between these concepts, we look at the scope of practice, and it's a general description of the services that we need to deliver, and it doesn't include a list of specific tasks or procedures, but it includes policies and protocols that will guide you, because the scope of practice is very much linked to policies and protocols. Whereas if you go to practice standards, that's an authoritative statement of which is required and expected of the professionals, and it describes best practices, and it guarantees a consistent quality of performance. So this practice standard is the SOP that we're going to talk about now. And it tells you what you must do, what is being expected from you, what steps you must take, how you must deal with a certain procedure in a certain situation. But one must always look at what are the best practices. And what I've experienced, and I've been in that situation many years ago, is that people don't have time, managers don't have time to go and see what are the best practices out there, what is the internationally, nationally, the best practices, and what is the latest approach. So they don't update the policy, the SOPs, and they just keep on carrying on with what they get, but it's outdated. And in the meantime, they share with the staff what is the latest approach. So they're not working according to the SOP, or they ignore the SOP. And it's important that we update that SOP according to the latest information and the best practices out there. Then the last one is the competencies. Competencies are the requirements needed for being competent in a specific role. What do we expect of registered nurses in their specific roles? We expect competencies in a ICU from people working there will be slightly higher than the people in the general ward. But there are also competencies that's applicable to all of them. So that is the competencies. And if you look at the SOP, you have to consider the competencies of the people who's going to work according to that SOP. So let's go further to the SOP. SOP is a document that's compiled by the organization or the unit, and it's to indicate the processes and procedures that should be done in the organization. Now, that by looking at that statement, it means that the SOP that you're going to have in your institution is only applicable to your institution. It's not one that's going out to all the other institutions. But there are situations where you, for example, in the private sector, where the head office, they will look at SOPs or procedures that is common in all the hospitals, that sort of a generic POE or POEs, SOP, that they need for all the institutions. So then they have a generate one for all the hospital institutions to work according to that. But that's normally the ones that's coming, that's identifying or explaining the routine procedures that all the institutions must do. So you will find some of them in the government hospitals as well, but not as much in the private hospitals. So the decisions is usually based on a policy which was formulated according to specific needs in the organization or the community, and which leads to problems, and they have to solve the problem. So let me just explain the policy procedure or the problems that I'm talking about. A policy, and we've got different policy. We've got the national policies, we've got provincial policies, and when we've got institution policies from the CEO, we've got policy that's coming from the nursing manager in charge, and then there can be a policy in the unit by the unit manager, or also called the operational manager. Now, if you have a problem, let's go down to the hospital. If you have a problem that you can't solve and it keeps on coming up, then you have to do something about it. And by saying that you have to do something about it, then you have to start off with a policy to put out what should happen. And then from that, you have to create a SOP to say step by step how they can deal with that problem, so that you can solve the problem and not getting the problem over and over again. So the difference between a policy and an SOP is that the policy states what should be done to solve the problem, whereas the SOP explains how to solve the problem. But there are also routine procedures I had just mentioned that you have to follow, which are described in SOPs. And routine procedures is not linked to problems or to problem situations. It's just a routine that I have to do over and over every time. Let's look at the hospitals and look at the nursing staff there. All the hospitals, you get patients coming in. So admission of patients is a routine procedure in the hospitals. And it's not because of there's a problem, but it's a routine procedure they have to follow. And the same with the discharge of the patient. But also to look after a patient, the care that you have to give for the patient who's not mobile, where you have to bath and wash those patients. Sometimes you have to feed the patients. So those are routine things that's coming up, and you need a policy for that, a SOP for that, to say how we're going to deal. So there's not a policy because there's not a problem, but you need an SOP of to say what's the process they have to follow, and step by step how they must go according to that. For example, if you have the admission of the patients, and I know I've heard that some people will say, staff, they every day they are responsible for the admission of the problems. And then they said, I can't take it anymore. Just give me another role to play in the unit. Because the admission of the problem patients takes quite a lot of time, because you can't just welcome the patient, introduce yourself and identify the patient, take it to the bed or the room where the patient must be, and then start preparing for theatre or wherever the patient is going. You have to get some information from that patient. You need to assess that patient's condition, look at the skin. Are there any thing that you can pick up from the skin? And you have to ask the patient questions about medication. Now, what I've also found that I want to just share with you is elderly patients. They quite often don't see, they think if you ask them, what are you on any medications? What medication? They just see it as the chronic medication that they use or medication that's been prescribed by the doctor. But they don't see the medication that they use, that they buy on over the counter, and the natural medication that they use. They don't mention it. And that is dangerous because some of those natural medicine is very dangerous, and we have to know about it. And we actually have them to stop that. So look out for that if you get the information from a patient, specifically elderly patient, and ask them about natural and over-the-counter medication that they use. What do they use? The aim of SOP is to achieve efficiency, quality output, and consistency of performance. And that's important because we want to give quality care to our patients. So we need the output to be quality and efficient, and they must be consistent performance of how they deal with the patients. Then secondly, to reduce miscommunication and failure to comply with regulations. If you look at the SOP, keep in mind these regulations that you have to take in consideration as well. You have to look at SANC, you have to look at the Nursing Act, and and that is important that you include that and not implement you by not looking at the criteria that SANC is actually got for you, because you have to stick with that to be legal. Then the benefits. What do we get out of policies? Sorry, I'm so much with policies and SOP, I mean. First, you save time and effort. You save time in the sense that a person knows exactly what you're going to do, get ready the stock that and the equipment they're going to need, and not running around going to a patient's bed, want to do a wound care, for example, and then realize, oh, I haven't got this, running back, come back, running back for something else, wasting time, wasting a lot of time and a lot of effort as well. So it guides them that they can work in a way that they save time and they save a lot of effort as well. Secondly, that guide you to perform an activity. It tells you exactly how to do an activity for that specific situation, is that you have to take step by step. And then Brian say, a very important statement, productivity is increased by improving work procedures. Just repeat, productivity is increased by improving work procedures. And that is important to keep that in mind. Now, SOPs must contain information which is specific to the organization or the unit. And I've mentioned it earlier on because it's written or compiled for that specific organization or for the specific unit. You will get SOPs in the organization that's applicable to all the units, but you will also get SOPs in the institution that's only applicable to a specific unit. For example, your SOPs for the ICUs will be different from the SOPs from general wards or from pediatric or from maternity. Maternity will be different from the others. So it must be specific for the organization, but it must also be specific for the unit. Research must be done to be up to date with the latest approaches. And that's very important. And I know people say we don't have time for research. But I can tell you, we've done a workshop. And what came out of that workshop, it was a week workshop about with the managers, about management. And a lot of them is actually putting time aside to do some research just to be up to date with what's happening. So it's important to look at that research and then use those research to when you create your SOP or when you have to change the policy, the SOP. You have to be available, the SOP have to be available for the staff members in the unit, and it must be updated if there's new approaches. Now, the availability to the staff, it's important that they know where to find it. It must be, and there's no use if it's not updated and they know where to find it and they use the old version of the SOP. There are different types of policy. I want to apologize for this little one here at the back. Types of policies are checklists, where you have a policy in the form of a checklist. And then you have a second type of that's more common is a step-by-step list, where you have a list and you say step by step, how are you going to do this procedure? And that's the most common one. And then there's the others as well. There are the list or process flow charts. Further about SOPs, it explains how to perform an action and not just very briefly. It has to be very specific, that they explain in detail how to perform an action. It also leads to standard activities and actions, that the activity is exactly the same, doesn't matter which staff member is doing that protocol or that activity, and the actions. For example, we hear from time to time in hospitals where a patient, maybe you've heard it as well, where the patient would tell you, I had Sister so-and-so yesterday to do my wound care. And she was so good. And now today there's another sister, but she's different from what she did with the other one. She's got another approach. So who's correct? So no patient should experience that. It should be a standard activities and the actions must be the same, and that the patients can see. Doesn't matter who's doing a wound care, who's doing what, it's exactly the same. They're following the principles, they're following the same procedure. And then provide steps to follow. We mentioned that previous, and work procedures are improving, which is a statement that was made, that there's definitely improvement in your work procedures because you don't doubt what you're going to do. You're not uncertain and think, okay, shall I do it this way? But you know exactly what to do if you use the SOP. Then address problematic procedures. If you have very difficult procedures that you have to do, that they have to carry out, and I'm thinking specifically like in the ICUs or in maternity or in specific areas where it's not straightforward, then you have to formulate a SOP that address that specific problem with a procedure. And sometimes it's problems that's between the staff members, that they're not agreeing what to do. So they've got different opinions. But the only thing that they have to look at is the SOP. Then valuable for orientation of staff and development of staff. And that is very important that we use it. And I think most of the institutions, they use it for those purposes, for orientation of staff. If you appoint new employees, they're going through an induction period, that's in a couple of days, where they just get to know who's the HR person in the hospital, going through the hospital, what can expected from them, and so forth. Then they go into the unit where they work, and they get orientated over a long period of time, anything between 3 months to 6 months. And those people, you don't have time as a manager to go and sit with them and work with them through the SOPs and tell them the procedures, how to do that. So what you do now with the procedures, with those staff, you give them the SOP files and they can work through that, but don't expect them to read through those files in one day. It's not practical, because you can only take in so much information, but that they can take it over a period of time, read those SOPs that they've got. And even if you've got staff that's not according to the criteria and you want to develop them, then you have to, you can use that as well to use them. So why do we need SOPs? First of all, to save time. We don't have time anymore, we're shortage of staff, and that is a big problem. So, and secondly, to ensure the safety of employees. Now you will say, but how is that possible that the patients can be safe? The employees, safety of the employees is ensured because they know what's expected from them. They know what is coming, what is expected from nursing council side, and that's been built into the SOP. And by following the steps of the SOP, they cover themselves and they are safe when anything happens. That if they've got a problem with the procedure and it wasn't done according to the SOP, then that person is in big trouble, and they can end up in disciplinary hearings and etc. But they can also, when there's disciplinary hearing of something that went wrong, is the question: is there SOP, and did this person know about the SOP, how to follow it? Yes, she followed all the steps, and she's safe of that. So it improved communication as well, where people discuss that and talk about that, and they've got more time to communicate, and then enhance accountability. Once you do that procedure and you look at the SOP and you follow that, then you realize, but I'm responsible and accountable for what I'm going to do. Accountable if I'm not following the procedures. I would set up step by step. If I skip a step, that's really important. I'm accountable for what I did and did it or didn't do. Then provides consistency. I've mentioned that previously, that they must do all of them, the staff, if they're doing the same procedure, must be done in a consistent manner. Then maintain organizational knowledge. They will understand what the organization is expecting from them, because it's set out in a SOP. And then provides a guiding hand. They don't have to go and get somebody and ask them to help them and to guide them. They can use the policy, the SOP that will guide them. So they've got the guiding hand from the SOP. And then on onboarding and training, I've mentioned the training, how you can use that SOP for training purposes. Then the principles of writing a procedure. The principles to apply are the same as the principles for policy formulation. That's not different, it's the same, it's just on another level. So firstly is identify the target groups. Before you start, you must know who's the group that you're going to create this SOP for. For example, is it scientific principles of nursing that you're going to focus on in this specific SOP? Or is it management of staff that you're going to focus on? Or is it training of students, etc.? So you must know the target group. And then you must also know the competencies of the group members, of the group that you, the policy, the SOP is being created for. And you look at the competency of the members, and they will give you an indication of how much information they need in that procedure. So if it's not, if a group of members is giving you, or you realize what their competencies are very high, but they're not the only people that's going to work with this SOP or work according to the SOP, then you can't adjust that only for that group. So you must take the other people in consideration as well. But if it's a group that the competencies is on the equal level, then you can you get a very good idea of how much information they're going to need that you have to put out in the SOP. Because sometimes it's very irritable for people if they get all the little detail in the SOP, but their competence is on a higher level. They think on a higher level, and they're the only group working with that SOP. Determine the priority for the description of the procedure, and then you can, this can then, through the analysis of the patient profile, you look at the patient profile in the unit and the type of nursing care that they render, profiles of the patient that's coming in, and put the two together. And you look at the interactions that have an impact on the quality care as well. And then you identify the interaction of the group members in the unit. And you prioritize them and decide which one is the most important. Then describe the procedure. A conceptual framework for each procedure is necessary. And describe according to the actual practice in the unit, and check with external sources and literature. So the resources, external resources is important. I keep on coming back to that. And then the literature that you must also, and I want to add legislation that you have to build into the SOP, because that is important. You can't ignore the legislation. Then questions that you have to ask. We have asked questions about why do we, about the procedure, why do we create this procedure, SOP, and what do I expect from it? So first you ask questions of what is the purpose of the work? Why do I want a SOP for that specific procedure or activity? What is the purpose of that? And then, is it really necessary, or don't we need it? Can we just inform the staff and not having SOP, have to create it? And can it be eliminated, that SOP, that you don't have, need it? And who does the work? Who's the person who's going to do the work that you have to target, or we have to keep in mind when you formulate that? And then, can someone else do it better than that person? Or can they do it better than you, who's going to create the policy, the SOP. And then can it be delegated to someone with less skills? Sometimes you're in a position where you can delegate it, the procedure, the writing of the procedure to somebody with less skills. But it depends on what type of SOP you are going to create, because you can't always just delegate it to anybody. So you must sure that you can delegate it to a person with less skills, or if you're not sure, then you can't do that, and then you must create it. Is there a duplication of effort? That's a question you have to ask yourself. And can 2 or more activities be combined? If there are 2 activities that's very similar, and there's very little overlapping, then you don't combine them. But if they're very similar, it's a lot of overlapping between the 2, then you must make a decision. Am I going to combine it? Is it on the same level? And will changing the chronological order improve the outcome or not? Does it matter if it's chronological or not? Can I just apologize? I just want to open the door for this little doggy. I was barking the whole time. Apology for that. Apology for that. So let's carry. I can now bark outside. Then the SOP, if you're going to write your SOP, what format must you follow? First, there must be a title page, and in the title page must be the title. What is this SOP about? What are you creating that? For example, admission of a patient. SOP ID number must be there, it must be numbered. Then the names of the people who created the document. If you're going to create that document, your name must be on the title page, and there must be a signature from you as well. If it's more than one person, and then you have to add both. I just want to mention at this point that don't try to formulate the SOP on your own. Utilize other people, utilize the staff who's working, who's going to implement and working according to that SOP, and ask them after you created it their opinion, because sometimes I will tell you, what about that? And they've got a different view of looking at the SOP. Okay, there will be some things that you build into that SOP that they haven't thought about or they don't agree with. So you don't have to look at that. Just involve them in this SOP after you've created it. You can even get their opinion as you work through this SOP and create it, get the opinion of the people from a unit where it's applicable, or if it's more than one unit in the whole institution that it's going to be applicable, get people from each unit and get their opinion about it. Then the dates when the document was created and edited, that must always be on the title page. And then the department or division that will use the SOP. If it's the department, you must put there which department. If it's a division or unit, then you put which unit it's applicable. For example, if you have a SOP for maternity, then it must be for maternity and not for another unit, because it's only applicable to maternity. The same with the neonatal units and by ICUs, etc. So it must be identify the specific department or unit. The signatures of the person who approved the SOP, because remember, after you've done all those and created and got the title page correctly and the content correctly, then you have to submit it to the higher authority to approve that SOP. And it's usually the nurse manager, nursing manager in charge of the institution. Then tables of content. You can include a table of contents if your document is very long. And this way your employees will easily find the section they need in no time. Some of the SOPs is very, very long. It's pages on pages on pages. But the majority of SOPs you will experience, I don't know if you've experienced it in your institution, because all of you have got SOPs. I'm sure about that in your institution has worked with the SOPs. And some of the SOPs are very short. They say 2 pages that they've got. Then you don't need a table of contents because you can get to the information very quickly. Then preparatory information. The purpose of the SOP must be put out there and must be clear. Why do we need this SOP? Why did you create the SOP? And then the scope of the SOP must also be very clear and indicated to the person who's going to utilize it, to know why is there a SOP and what is the scope, who is involved in that SOP and who's responsible for that, and the roles and responsibility of people who are directly involved in the process. That must also be there. And then resources and materials that the employee will need to complete the procedure. That must also be specified. And most of the SOPs that I found in institutions and in hospitals where I worked as well, they didn't mention about resources and materials that they're going to need. And that's a problem, because if they want the staff to follow, to do that procedure by following step by step the SOP, there must be indication of what resources they're going to need and what materials they're going to need, that they can prepare themselves before the time, and not leave it there and going through to the patient and then keep on running back because they don't have the materials that they actually should have. They forgot about that. And I've seen it, and I'm sure you have seen it as well, that because they're always in a rush, and with a shortage of staff and with this that we've got, they rush against time. And so it's more important then that they go through the steps, prepare the resources, prepare the materials, and get everything on the trolley before, if they go, for example, to do wound care of a patient, that they've got everything that they need on the trolley and go to the patient, and not keep on running back and looking, or ring the bell and ask somebody else to bring it to you, which I've also experienced. So that is important. And then what I like is, and we don't see it, I haven't seen it in SOPs in the hospital, but I think it's important that the cautions and warnings related to the procedure or material used in the procedure, that is also identified if there's also any warnings that you want to put out. And I think specifically about the medication rounds. The medication rounds is a nightmare for me, and I'm sure for most of you as well, because there's a lot of medication nowadays that the patients are getting, and it's very difficult sometimes to get all the patients the medication on time. It's not practical because you can't be at all the patients at the same time, so it takes a lot of time with a number of medication. But there must be warnings for certain medication, that what they must watch out for, what they must, observations they must do, and what they have to identify the medication and identify it with the patient's name, and not going in and just say, oh, I'm working here for the whole week, I know exactly this is Miss so-and-so or Mr. so-and-so. No, you have to identify. So that is also good to build into that SOP, that they can follow that steps to protect themselves, as well, to be very cautious about what they're going to do. Then we're getting to the procedure section, which is the essence of the SOP. And Here you describe what you need to be done, and the order of the task, and the methodology your employees need to follow. It can be a list or the different steps, and if the process is very complex, it can have steps that you describe all the activities in detail. Also include supplementary diagrams, images, or illustrations when appropriate. Not all of them, just when it's appropriate. Imaginary can sometimes be a more effective way of explaining how to get things done. For example, and I've seen that if you have a SOP, let's take an SOP about how to do blood pressures and vital signs, what blood pressure is part of. I don't know, but I'm sure you've seen it. I've seen it, that if you get to a person who's doing the blood pressure, how often you get people that's not quite sure how to put on this cuff, the pressure cuff, and how to do that blood pressure. Somebody once told me that they came into a ward and there was a person that wanted to do the blood pressure of a patient who wasn't very seriously on a leg. So it's good if you describe the vital signs, SOP for the vital signs, the steps that they must follow, and you get to your blood pressure. It's good to take a picture or to put some in to show them where to put the cuff, in which direction the cuff must go, and how they must treat the hand, the arm, etc., etc. Because otherwise they keep on getting wrong results, wrong outcomes of the blood pressure that they treat. You must make them aware that if they do the blood pressure and one patient, and you get into another patient, and they've all got the same blood pressure, there's something wrong. There's something wrong, and they must then not use that blood pressure apparatus further. They must say there's something wrong with that. And the same with taking other, if you have your thermometer, nowadays we've got the digital ones, and even that. So you can build that into your SOP, because we're so used to just do it and it's done and off we go, not thinking a little bit further. I've got here for you 3 examples of SOP templates. And this one is a very short, simple one. And you will see that they have the SOP name and title. Then they've got the document storage location source, document number, and the SOP originator, the name and the signature, which we've mentioned earlier on, the approving position, the name of the person and the signature, and then the effective date. When it was done, put the date, the last edited date, and that's important, and others. And I want to say that in the others, it's good then to put the date that you're going to review it. Now, if you read NBooks, and I will say that you must review your SOPs constantly. You must do it every year, but it's not practical in our situation. We're not going to, we know short is a year, and before we know it, we're in the next year. So make it a little bit longer, like 2 years or 3 years, but always keep out and be aware of changes in the society, changes in approaches of that specific document that you use. What are the approaches? What are the benchmarks? What are the best practices? and then you have to change it before you get to that date that you actually said you have to review it. Then your purpose that we mentioned, you have to put in the purpose why you want that to be created, the scope, responsibility, and then materials. That is the step, how they're going to follow it, and then related documents that they can relate to that. Then you've got another one that I've got here for you. That's a little bit more detail. And I like this one. It's the name of the facility. Then they've got the page from page 1 to page 9. For example, they've got the SOP number, then the revision, when they're going to revise it, and then the title of the policy, the SOP, the author of the SOP, and then what they've brought in here is the quality assurance authorization signature. Now, one of the things to make sure that your policy is successful and is accurate is that you can have the review from quality assurance group that they can look at that. So, and it's the first time that I see that they've got the quality assurance that they put in there for authorization. But this is a general one that I've got here. So, but it's good to look at the quality assurance authorities as well. And then the effective date and replace the revision number when they have to do it. What they have then in the procedure itself is the purpose again, the scope, responsibilities, who's responsible for what, materials and equipment, and then safety issues, which we mentioned earlier on as well, that they must watch out for that based on that specific SOP, and then the procedure that they have to follow, and then reporting. After you've done a procedure, you have to report it, you have to document it. And that's very important, that you have to build into the SOP, that they must record it, and they must report if there's any abnormalities, they must report it, and they can't just leave it. Then references documents that they use, and then change history. Change history is when's the last time they did the updated the policy, the SOP, and how many times has it been updated. Now, I want to share with you another document that I've got here. If I can just get to that. This is one that I've just created, and it was what I saw in one of the SOPs, and I thought this is also another way to look at it. And this is, and I've just created this to give you an idea of how you must think based on the unit. And this one is in the neonatal unit. And it's a very basic one. I just took one title of Care of the Eyes of a Neonate. Where you've got the bundle, the title, the SOP prepared by, that's the same. There's no changes there. And then the issue dated May, and the version is the first version, and then when it needs to be reviewed. Then the table, you've got the table there, and then I want to just show you what you can do. The purpose of the standard operating procedure is to provide a guide for neonatal eye care to prevent infection and promote health. Definitions, then you give the definitions of neonatal conjunctivitis and severe conjunctivitis, and you can add on to that. The scope is of this SOP covers the process to be followed for eye care in the neonate and the identification of eye infections. The procedure applies to all midwives, accoucheurs, registered nurses, or enrolled nurses, in brackets, under supervision of a midwife, accoucheur, or registered nurse, close the bracket, working with neonates. Then the objective is to ensure a healthy baby by using eye care to identify any neonatal eye infections. The equipment they will need cotton wool, they saline gloves to wear gloves, and eye ointment or drops if it's prescribed. And this is the one that I want to share that I actually liked, and it's a way maybe you can use that as well. The step is that they follow is assessment, planning, implementation, and evaluation. Then there's actions. I've just put a few of them. The assessment is observe the following, which may be an indication of neonatal conjunctivitis. So assessment, you look what you see. Then planning is how you're going to plan and put out your equipment that you need and your material that you need. But in this case, and that's why I took this one with a neonate, you have to inform the mother of the procedure and the purpose thereof. That what you must do before you do anything, to involve the mother. Then implementation, very important, identify that baby and with the mother as well. And then evaluation, after you've done all your steps, you must record and report what you've done. So record the procedures done and the outcome, you document that, and record the health education provided. And that's one of the things that we forget with neonates and with pediatrics, that you have to give health education to the mother. And most staff will do it, but they don't document it. And then the document history, related policies and procedure, and the references. So let me just go back to my slides. We're done, almost done now. Just click here. Now I can't get it full screen. Okay, not to waste any time, I'm just the conclusion page that I've got, and I'm just going to scroll down to that. The conclusion is SOPs are well known in organizations, but not always in line with the best practices or the latest approaches in nursing. Therefore, it's important that the managers themselves are updated with the latest research and update the SOPs if needed, and also have to decide how often the policies and SOPs will be reviewed, and the timelines must be practical and achievable. So the managers are accountable for the quality of nursing care and the quality of management, and this requires getting guidelines in the form of policies and SOPs. Thank you for listening to me, and I hope you got some information or a picture of how you can work with your SOPs. Thank you.
Thank you very much, Hester. This is awesome, and I am personally a fan of procedures and SOPs, and and looking at the feedback and the comments from everyone, I believe this was very, very valuable, and I'm hoping that colleagues, we understand that to standardize, to improve quality, to improve productivity, and to ensure that the maximum benefits of our services are received by our clients, we have to have procedures. We need to know what we are doing when we take blood pressures, temperatures, but I think also we also need to appreciate what then happens when procedures are not in place and the risks that are introduced because of that, so it's quite a very, very, very important topic. Maybe before I go through, actually I've been writing some of the questions, so maybe Hester, we can have a conversation, me and you, One of my takeaways, as you were saying, policy, SOP, I noticed that the policies talk about the what. So a policy statement will just tell you, what needs to be there. You must provide a service. You must screen people for TB. But a procedure will then talk about the how. So the how question, the what and the how, the how. So the steps that need to take place to ensure that every patient is screened for TB or sugar and so on. Am I correct in my understanding, Esther?
110% correct. Thank you.
That's superb. So I saw one of the questions is, so who must do the SOPs? So a health worker is asking because they believe, there's a number of questions which are raised around that. Someone says, I'm working in a clinic. Should I develop my own SOPs or do I have to wait for the district? And someone says, well, I'm a clinician. Let the CEO write the SOPs and give them to me. And maybe I'll implement. Who must write the SOPs, Hestel?
Okay, the first one, or the one that says she's working in a clinic and ask if she can write the SOPs. Yes, you can. You must decide why you want that SOP and go through that questions that I've put there, and then ask yourself, how have we done this up till now? What are the steps that we followed? And I want the people to follow this and this steps. And then you can create your SOP for your situation and share it with the people that's working with you. And then you have to send it to your superior that they can approve that. And it becomes a legal, let's put it in brackets, legal SOP.
Superb, superb. And I think on that note, I noticed that if SOPs are written at a district and you have like 20 clinics, a certain clinic has 1 nurse, the other one have 10 nurses. My clinic has 2 consultation rooms, the other one has 10. So you'll find that SOPs written at a very high level cannot be easily implemented, at your facility. Therefore, you need to write your own based on the resources, those materials and equipments, what you have, so that you see how you can make it work. Otherwise, it becomes a bit non-applicable. Hestel?
Yes, you're correct. You must, the SOP must suit your situation. And I know it's very difficult. It's easy for me to say, create an SOP, step by step in detail how they must follow it. But with shortage of staff, I know it's a huge problem. But we mustn't justify that and say, oh, we just shortcut this SOP. But look at what's happening in your institution. So in this case, you are going to create a SOP for your specific clinic and not for another clinic as well, for your clinic.
Yes, this question comes from me, but I saw a related question and I just wrote down as you were writing to say, is writing it enough? And someone was saying, are they readily made SOPs? So, and you would know with the compliance, people have a way of, if they know that they are going to be assessed tomorrow, they go and take SOPs from other clinics and make copies and create beautiful files. Does that yield the results? Is writing it enough? What needs to happen after you have an SOP? Is writing it enough to make a change?
Okay, once you write that SOP and share it with your staff, and then you had to send it, like I said, to your superior to approve that. And once you've got that approved, get your staff and inform them about this SOP. Give them it, and if it's possible, and I know in clinics and with the cost, it's not always possible to make a copy for each staff. But if you only have 10 or 5 or a small little group, make a copy of that and then say to them that they have to read through it, or you can take the SOPs and then circulate it through all of them. There's one thing that I didn't mention as what you can also do if you've got that new SOP, and it's been approved. Create a document there that you actually with a name, and if you need some help, I can always send it to you, where you've got the topic, what is this SOP about, and then you have a table where the people must read and then sign off that they read the SOP. But reading a SOP is not enough. You can read the SOP or any other document, but you don't understand it. You can't interpret what they say. So what I've did is that they must sign that they read this policy, this SOP, but they also understand it. They know what it is about, and that is important. So you keep track with that. But I can warn you now what is happening in the services. People don't complete that form, but force them to sign off so that they can't come at the end and say, I didn't know about that. They know, they signed off that, they know and they understand what is being expected and what's been put out in the SOP. What was the other question is?
No, it's the same, but maybe what you can try and deal with is, so people don't have time. I always hear people say they don't have time. I work in the NGO sector, and even in that space, if you are funded, you need to have policies and procedures. People have time to chase fires, but they don't have time to write SOPs. How do we make time?
I think as a person in charge in the clinic or in that area is we all realize that what is being done, what the staff is doing, the procedures that they follow is not right. It's wrong, and they're not compiling with you the scope of practice of them or what's been expected by the nursing council, the standards. So then you have, I would say, start with the most important SOP that bothers you, that you're very worried about the situation, and start with one off. Don't think that you can write a lot of SOPs in a month. Take it slowly, but take the most important one. Remember one of the slides that you must look and prioritize what is important, and then write that one. But when you write it, keep it in mind that, okay, this is what they should do, but they don't have time. So they're going to sidestep it. How can I justify that? How can I change it? And the question is actually, what do you expect from them? What is the steps that they must take? And then you must utilize that so that you've got consistency in your unit, and you can, and people are very scared because you can use that to evaluate the quality of work, but that's not the main aim of that. It's actually to get better care for our patients and consistency, that everybody is following the same process. I don't know if I'm answering your question.
So yes. I think that is quite perfect, especially around prioritization and the importance of dealing with things that are important first, and then maybe creating time for the other things later on. And someone said, I think it's Getika Sharma. I hope I'm mentioning your name, Getika, properly. Says she wrote an SOP, and the junior said, no, that SOP is too long, and reduced it to 4 sentences. And I've seen other comments saying, how long should it be? Is it 5 pages? I mean, I know that big companies have procedures, especially mining sector. You'll find a 100-page procedure. But in your experience within healthcare, within the units, is there an acceptable number of pages, or sort of what you should be targeting?
Yeah, no, there's not a specific number of pages that you have to put in. What's important that you put in the first session that I've got, the purpose, the scope of practice, and who's responsible, who is it applicable. If you look at that last document that I've seen, where I said who's applicable for that, I wrote there about the eye care, the neonatal eye care, where I wrote about the people who's responsible and for that SOP. But coming back to how long, I don't think the ideal is that you have a detailed SOP, okay? But I'm also coming from a practice where you really ask yourself, must I really put all of this in? What is the most important steps that they have to take? And what in the presentation, I also mentioned that you must look at the group that you've got and in the competencies that they've got. So then you don't have need a long SOP. It can be a very short one because I know they've got a lot of competencies that's already applicable. So you can only make, I've had in the hospital, the last hospital that way, a SOP that was only 1 page.
Yeah.
And the one that had 2 pages. Yeah. But it depends on what is what is the title, what is it about that you are there. So yes, that it's difficult, and maybe you can start off with a SOP that's not that long, say 2 pages, with the steps, because I can understand why they complain. You know, they don't have time to follow up and read it, but you can also then start off with that, and then as you approve in the future, you can just add on. If you see, but they're skipping this, that is important, we must put that in as well. Another way to look at it is to look at how do they, what do they do with this procedure, this specific procedure in the clinic? And then ask yourself, but what should they do additionally that they're not doing, they're skipping it, and focus on that as well.
Superb. I like your answer to this particular question. Batiliso, there's Batiliso. She has raised her hand. Teguza Kanaka. Batiliso, are you able to hear us?
Yeah, Dr. I can hear you, and thank you very much for the opportunity. This is one subject that's very close to my heart. I'm a quality assurance manager at Charlotte Maxeke Johannesburg Academic Hospital. So there was a question that somebody raised where they asked for people don't have time to read policies. So I just need to clarify that. In terms of SOPs, we look at what we call a process of triangulation. Dr. I know you've spoken about it before, where there is a procedure that is detailed and written down. Secondly, that people have read the procedure. But thirdly, that you actually see the witness and see the procedure in practice, so that as a manager, a supervisor, you can then correct where you are seeing gaps in terms of how the process is supposed to be implemented. So I also liked what the professor said in terms of people signing that they have read the policy. Remember that we are not talking about novices that are new in the system. You're talking about people that are already in the system, and there is an expectation that part of knowledge management has to come from the person themselves being interested to know what they are supposed to be doing, especially in line with your scope of practice. And then I think the other thing was the issue, the length of the SOP. And correctly so, you cannot determine the length of the SOP because it depends on the issue that is being discussed in the document. But what I find is helpful is over and above writing, because I know sometimes, like we say, people don't have time to read, but it helps to have a one-page process flow document that sort of takes it step by step, but it's almost a summary of what would have been contained in the long document. There was something else that I had put on the, importantly, we should not forget stakeholder engagement, especially those people that are implementing the SOP. It is important to engage them right at the beginning when we are starting to either put together this SOP or review it, so that they can then tell us what happens on the ground, because most of the time policies are put together by people that are not actually doing their work, but we need the input of the people that are actually going to be implementing the policy. I thought I should give in those few inputs from my side, and thanks for the opportunity once more.
Very, very, very valuable. And thank you. QA for such a big hospital. Ooh, one day you must tell us how you are coping. It's not a ward.
It would be a pleasure, and we might actually take more than a day.
Any additions, Estelle? I think she was
I just want to,
yeah,
I just want to say thank you for that, and I agree with you, and I'm so happy to hear that that you actually the SOP is to your heart as well. So thank you for that. Maybe you can, some of the other people nearby, you can support them as well.
Thank you. Okay,
I
one more.
I would appreciate it. Thank you.
Thank you. And then we've got one more comment from Mamsi. Mamsi, are you able to unmute? Yeah.
Yes, Doctor. Thank you for the opportunity again for this webinar. Estelle, thank you so much. This is quite insightful. And now that we know that apart from the managers, us at the ground level, we can write the SOPs and send to the managers for approval or review, so that we cannot run like headless chicken, especially at a new institution where everybody's from advanced institutions or has had experience. Now, when we are here, we are running around like headless chickens. There's no SOPs, there's no guideline, there's nothing to put us in place. So we are implementing according to our previous institutions, of which other things are quite different. But thank you that we are in light that we can write the SOPs and send for approval. And again, for the issue of accountability and capacity building as well, it was quite informative. Thank you very much, Ngaka.
Thank you very much, Sis Mamsi. Estelle, I think Mamsi mentioned something which is very important, because to be honest, we all end up, all of us where we work, there's a possibility that half the policies are not there or procedures are not in place, and we are working, and that puts a lot of risk as well. And someone was asking in the questions that were to say, so if you find yourself on the wrong side of a policy that is not written, how is that managed?
If you find yourself on the wrong side.
Yeah, but of a policy that you are not aware of.
Okay.
Yeah.
If you're in trouble because it affected a patient, then they will probably go the process of disciplinary, but they have to investigate before. And then if you wasn't aware that there's a SOP, then they must take that in consideration.
But what I know as well is that you're also judged based on your profession and what is expected.
Yes.
So there's the SOP part, but if you want to say to me, Dr. Mawel, by you saying doctor, it means there are certain minimum expectations as well, to say you are things that you're supposed to know, and you saying I didn't know sometimes is not good enough, and it depends. I think that's why Estelle is recommending that there will be an investigation and to check, how the deviations and the causes, and obviously doing a root cause. That procedure might be part of the things that need to be written. But as a health worker, as a clinician, you'll also be judged by a different clinician in the same scenario. Would they have acted differently? So sometimes you also can't hide behind I didn't know, so which
Yes,
tends to happen.
with you.
Yeah, so two last questions, Estelle, from me based on the discussions that I see. Someone was asking around tools and forms. Do they put together as part of the SOP? Because the implementation of most SOPs requires some form, some tool to be completed. Yeah.
I don't understand the two.
So the question was around forms. For example, there might be an SOP that says, okay, let's keep it simple and say it's an SOP on TB screening.
Mm.
And there is a form or a screening tool that has to be used. So they're asking whether these forms or tools should be attached to the SOP, or how do you make reference to the different forms or things that need to be used? Yeah.
I think you must just make a statement in the SOP how important is to utilize that form and complete it, and then refer to that form. You don't have to attach it.
Yes, yes, yes.
Because then it's getting very long again. The SOP gets very lengthy as well. So just link with that, because that's another criteria or another expectation that's linked to this SOP that you wrote. So just link those two and refer them to them.
Yeah, and someone says, so where should they be? Should the SOPs be in files? Are they supposed to be on the walls, in the rooms? Are they supposed to be on the intranet, the computer? So what's the best place? Yeah.
Okay, the intranet, and it's good, but you must have a hard copy in your units. That the best thing to use that is to put them in a file. And then mark it and have a indicate an index that if they want to have a SOP on doing wound care, let's get back to that, then they can just look at the index and they can go to that. So you must have the hard copies available, but you can put it on the computers and available, but you mustn't put it on the walls, because there's a lot of them. So you can put it in your, have a board in your tea room if you've got a tea room, and then you can put it up there for the staff, but not in the walls for the patients to see.
Right, so the last of the last, which is from me, it's a question of, so if we write an SOP, do we sign it off before we test it? How do we know that what we have written is good enough to be signed off? Is there a process to test and see? Obviously, we would have engaged and we have a high index of confidence that maybe our waiting time in the clinic will be reduced by this procedure. Do we test it first before it's signed off? How does it work?
Yeah, I think if you want to complete that, you involve the people who's involved in that SOP, the staff who's going to have to follow the criteria in the SOP. Get their opinion as you go on the SOP. Get their opinion about that. Involve them in that, and then once you've all agreed or you're satisfied with what you got, you can test the procedure as well, or you can get someone with a little bit of less knowledge about this procedure, and you can use them to evaluate or to the SOP and tell you how they experience it. One important thing is that we must write it in plain English, the SOP, and not be that everybody can read it and understand it, not be very high format, or not format, writing a very use words that not everybody is going to understand. So be very simple in what you write and clear English. Then you can get, after you've tested that with the staff or the area, you can get somebody to review it and get their opinion. And like I've mentioned, that one document where they actually use the quality assurance, and people know you don't have a quality assurance team or person in your clinics. So you can then send it to your authority and ask them their opinion before they approve it, because that's why they have to approve it. They must say, yes, we agree with this, or no, we don't agree, or what about this and what about that.
Superb. Thank you. Thank you very much, Estelle. Once more, a great one. You have just 30 seconds to say your closing remarks so that something we shouldn't forget, take home message. Thanks, Estelle.
Okay. Thank you. I really am very excited about the fact that so many of you responded and that it's adding value to you, and some of you it's going to do your own SOPs. That's why I'm actually having this discussion and trying as much information to give it to you. So I'm very proud of all of you, and I'm very proud of what you're already doing. Some of you has already got the SOPs. And if you do the SOPs, that the staff must understand the SOPs, link the SOPs to the policy, but some of them won't understand why there is a policy unless it's something that's in the institution and not from government or higher up. But share that with them and let them understand how important it is, what's the expectation of SANC. Use the SANC, the scope of practice from SANC, and the criteria that they expect, and how important it is that these SOPs. So use that in that sense. And I want to say thank you for listening. And the person that asked, is there anybody that can, if I'm correct, I've heard something from UNICEF that one person asked if there's not somebody to come and write the SOPs.
Yes.
And that same note, I want to say that person, if you ask me to come and do it, I will come and do it for you.
Good, good.
But in any case, thank you so much for listening, and all the best. And I'm sure that your whole practice will be improved, and they will be more consistent. It's going to take a lot of effort from you as a manager to create that SOP and then sell it to the staff. But in the end, you will see the benefit of that. So good luck with that, and thank you.